Good morning. It's Friday the 17th of May at 8 a.m. and this is ESO TV. Welcome. My name is Joanna Wardlaw and it's a great pleasure to be co-hosting this session with my co-chair Silke Walters. Silke, can I hand over?
Thank you. Good morning also from my side. As Joanna said, we've got an interesting morning lying ahead of us, and we start with the very interesting topic of sustainability in stroke care and stroke research. And today we've got four guests: Jelle de Mestre from Belgium, then we've got Beth Davis from the UK, who actually cycled to here, we've just spoken about that. We've got Antonio Giacarelli from Italy, and we've got Ann Palstam from Sweden. So if I may start with a broad question: why do we have to care about sustainability in the healthcare sector? Everyone speaks about traffic and all that and flying. What is healthcare adding to climate change?
Sure. Well, it's difficult to estimate because there's not many numbers out there, but it is estimated at about 5% of the total carbon footprint comes from the healthcare system. And there's many drivers within the healthcare sector that influence climate change, and some of them are not even things that we think about on a day-to-day basis. One of the main drivers, for instance, is the use of inhalation gases, which for neurologists is not that important, but for anesthesiologists, for instance, is one of the main drivers. And then, of course, we got insulation of buildings and energy management. Waste management is a big one, also for stroke, I think, the materials used. And then, of course, transport of patients as well as physicians, depending on the region people live in.
Perfect. And I think, Anne, if you want to add something about your stroke research and sustainability.
I think given the large impact on climate change of our own operations, we need to also include a perspective of sustainability in our research. So we need to start evaluating the carbon footprint of our interventions to see the true sustainable value of what we do to try to reduce our emissions, so we don't contribute to the problem.
So I'm a neuroradiologist by day, and it always strikes me that one of the hidden costs of healthcare, and this applies in stroke as well, is the use of large pieces of imaging equipment, which in themselves are extremely expensive to manufacture, but they also soak up a vast amount of energy on a daily basis. And I'm one of the advocates of minimizing the amount of imaging that we do in stroke. I think we grossly overuse it. What are your thoughts on that?
Yeah, it's very important also to reduce also that recycle. So and also as a society, as a European Stroke Society, we have we need to help to trying to avoid this kind of utilization of the imaging and of course of the other things, and ESO is very committed to this, to the project of the sustainability, and I like that, and that there are a lot of initiatives that we have done so far, and that I'm very happy and proud of that.
Right.
So you were running a session a bit later this morning. What are the key points that you want to cover in that session on sustainability?
So both Annie and Beth are speaking during the session. We've got two other speakers. Annie will shed some perspectives on sustainability in research, first of all, but also in rehabilitation. Maybe that's something you can talk about?
Yes, I will introduce principles for sustainable healthcare. And how we can use those principles in our clinical work and our research work to identify how we can strive for a more sustainable healthcare, but stroke care, and I will give examples from the stroke rehabilitation research, how we are using it right now. And also I will introduce a model for this evaluation with an example from our stroke rehabilitation research, how we are implementing this. But there's not so much done already, so we sort of have to make our own path for this.
I think not everyone will be able to join the sustainability teaching course. Could you give some of those examples you were talking about?
Well, in to evaluate the environmental footprint of an intervention, we try to estimate the carbon footprint of, in this case, how we can affect future healthcare consumption or long-term healthcare consumption through rehabilitation interventions, and hoping that our rehabilitation intervention will give the patients tools for better self-management and maybe reduce future healthcare needs. So we're following up on the long-term healthcare consumption and doing a carbon footprint on that. So we hope to see that we can save not only healthcare resources, but in that also reduce the carbon footprint.
That's an important point, and also all these follow-up visits, and we all definitely prefer to have the patients face-to-face, but what are your thoughts? Do you think it would be, from a sustainability perspective, would it be better to have follow-up visits purely by telephone, or a mail is quite difficult because usually we don't get the answers back and then our quality goes down? But how do you keep that in your future trials? What do you think about that?
I think that telemedicine is it should be the future, yes, and we have the possibility to do that, and it should be one of our main points also about sustainability. So.
I think what you're describing really is one of the pillars of sustainable healthcare, which is kind of low carbon efficient care pathways. But the greatest difference that we can make is prevention, so really focusing on moving to sustainable lifestyles which both reduce stroke risk and also reduce carbon emissions. So that's the biggest difference that we can make. And for those of us working in stroke care, we can really use our opportunity working with patients to counsel them on moving to sustainable lifestyles, both for the sake of their health, but also there is a lever there to sort of reduce carbon emissions also.
So, if one was being slightly devil's advocate, you could say these are all wonderful, noble ideas, but how are you going to take what you've implemented in your hospital, for example, and make it into a package which can be easily adopted in other hospitals where they may not be quite so motivated, they may not have so much time to think about it, but they want to try and make a difference? Are there packages which people can already start to try and adopt, or where is the field going with that sort of thing?
I mean, it is really difficult because this, the evidence that we've got for these interventions is relatively limited at the moment. So I think we need both a top-down and bottom-up approach. So you've got lots of clinicians that are really passionate about this, but we also need support from management and political will to actually do this. So in the NHS, we've got the Greener NHS initiative with a net zero target by 2040, for example. So that, coupled with action on the part of clinicians, those two things together are what will make a difference. The point is trying to do it quickly enough before we sort of see the worst health effects of climate change evolving.
Yeah. I mean, I wonder if we could think a bit more also about the research side, because interventions that always start with a research evidence base and then move into practice, and perhaps if going forward, research can be done in a way that also tries to capture the climate implications of that intervention or whatever might be helpful. I mean, at the moment we're in phase 3 trials encouraged to collect health economic data, so you can work out health economic impact, but there's nothing about capturing the carbon footprint of that project. What are your thoughts about really starting as far up the line as possible?
I think it's totally necessary because the economics is a resource which we acknowledge that we have to consider, but the environmental resources is precisely the same, so we need to include that also. The problem is that the carbon footprinting it's not there, so obviously like the monetary costs, but we can follow the England National Healthcare System, where they have done really nice work on carbon footprinting of healthcare activities, and we're using their estimates right now actually because we don't have anything in Sweden.
But the question is it not there, or are we just not used to consider that?
Yeah.
We probably just haven't cared until now.
It takes a long time to do a full carbon footprint cradle-to-grave assessment of each individual item that we use in pharmaceuticals. So what we're tending to do now is use carbon conversion factors, where we take the financial cost of something, which is very well known, and then use that to convert it into an estimated carbon footprint so that we can move ahead without having to sort of do a huge amount of groundwork, by which time it would be too late to act anyway.
But just thinking about the research side, I mean, what do you think are the biggest sources of non-sustainability or redundancy in research that could be easy targets? You know, you need to have easy wins to start with, otherwise everybody just gets disappointed and this is too hard and they give up. But so how can you kind of try and motivate people to think about what are the kind of obvious things that they maybe don't need to do, or things that they should do to make sure that their research is going to be as really important as possible?
Well, I'm not sure if this is the right estimate, but for me the easiest win would probably be going after the follow-up visits. Those can be mostly done by telephone, especially in stroke. We just collect modified Rankin mainly as a primary outcome, or we do scales. These are all things that can be collected over the phone, and it's already happening as we see in current stroke research. So that's probably a very easy win.
Sorry. But some things are then really already actually done research on, like you talked about the anesthetic gases, and that is actually very well described in research already. So if you can maybe switch anesthetic gases, or maybe you can do some preventive work to avoid a surgery at all, that could save a lot of, without actually having to do the carbon footprint again.
And I think beyond describing the carbon footprint of our own research, I think we also need to think about research gaps. There's a lot of evidence missing, I think, you talked about sustainable lifestyle and initiatives. And I think we are currently missing the data to support a lot of this sustainable lifestyle in stroke. The cardiologists have done much more research on diet, for instance, implications of a Mediterranean or mainly plant-based diet. These are things that we should try to implement, or at least copy into stroke research, so we can give that advice to our patients.
That is true. We've got these gaps, but we also have quite a lot of redundancy in some of our areas. And thinking about that might also help. If we reduce that might also help to be a bit more sustainable. Don't know whether you've got any thoughts on that, Antonio?
Yes, very.
Research redundancy, that's a big topic.
Is a big topic, and we should like to help each other and trying to avoid also the research, let's say, not very useful. We should try to help each other, like cardiologists with neurologists and other figures, and maybe trying to research and collaborate to make one or less study, but more of more impact. Maybe with more patient, maybe one study with a lot of more patient instead of different studies. I don't know, just thoughts.
Yeah, I mean, we've both been coming to these conferences now for a while, me more than you, and
Sure.
I'm always struck by, I mean, if you want to do a really good piece of research, it has to be extremely well designed, it has to be properly powered. You have to have done your homework to make sure you're not repeating something that has already been done and answered. And I must admit, I see cycles of things coming round again, and people, I don't think, give enough time and effort to really searching the literature. We've got really powerful search engines now. There's really no excuse for not, you know, in the days when you had to flick through the paper, fine, but now we've got really powerful search engines that can ensure that you are not repeating something that's already been done. And, you know, the use of tools like systematic reviews and meta-analyses to really put together the existing data. And so that even if the question hasn't been answered, it makes sure that when you do design your research, you'll be doing it in such a way that you are definitely targeting the bit of the question that hasn't yet been answered. And I don't personally think that people give enough time and effort to that end of the research design. And then, you know, everybody sort of quails at the thought of doing a power calculation because nobody feels very comfortable with them. And they're always a bit of a fudge. And I mean, it's such a critical part because if you're underpowered, you're not going to answer the question. And even in the last 2 days, we've had some fabulous research, but there've been a number of examples of big important studies which got stopped before they reached their endpoint. I mean, we've lived through a period of COVID. That's obviously had a massive impact on the ability to do research, but nonetheless, whenever that happens, because funder decides they've had enough or it's gone on for too long and so on, that's a really bad outcome. I wonder if people need to give much more thought also to making sure that their research will be doable, so they don't have grossly ambitious plans about how many sites they can set up and how many patients they can recruit in 3 years, and then of course it's completely undoable, and so they end up taking much longer and so on and so forth. So I think there's a lot of technical know-how that's so important to research as well that isn't anyway.
And this really is a good example, I think, of how ethics and sustainability is really interconnected. It's a question about patient ethics and the environmental issues.
Because it's almost unethical to, whether it was deliberate or not deliberate, to have designed a study which is not going to answer a question, and you wasted everybody's time and money.
That is so true. Very true. We are nearly at the end of that session. May I come back to the quite important question? It's all quite abstract that we discuss. What has changed in your daily practice now that you are more so involved in sustainability and climate change thoughts? Do you want to start?
Yeah, sure. For
just
me,
give the audience an idea of what you can do tomorrow.
Well, for me, one personal example would be just advising patients on a healthy lifestyle, because it coincides with sustainability goals, right? If we recommend a Mediterranean or mainly plant-based diets for which there's enough research to support that it reduces stroke risk, we're also reducing the individual impact of our patients. So that's a very easy thing we can all implement, I think.
One practical thing that we're doing on our stroke unit is we found that we're using 17 pairs of gloves, disposable gloves per patient per day, and we're 17.
I can easily imagine that.
Yeah. So we're taking measures to try to reduce our glove use with patients by engaging with our infection prevention control and procurement teams, just to at least try to halve that number, because it's unnecessary glove use, and that's just a small practical example that people can look at in their own departments.
Yeah, that's a really good
It's
idea.
a dreadful mental image of this enormous pile of gloves and plastic.
At the end of the day.
Well, I think that tomorrow we can also try to implement our telemedicine system, maybe trying to see the MRS by telephone, by video telephone, and also trying to take public transportation and train, of course, as we all do. Coming to this conference.
I'm a teacher and a researcher, so in my teaching I integrate sustainable healthcare and sustainable development in all my lectures to try and plant these seeds in the students so they can start thinking sustainability thoughts early on in their
to make people to raise awareness.
Yes.
Yeah, that's a good point.
Try and give them tools on how they could influence this in their work.
Yeah, we've already touched that at the beginning, but can you just summarize again what you've done and what ESOC has done to get more sustainability implemented?
Yeah, so ESOC is mainly focused on improving sustainability for the conference. For instance, we see all vegetarian catered meals. There's a waste management plan. Excess meals are being donated. ESOC is donating to Trees for All, so every year there's a big donation. We're encouraging people to take public transportation, and many people have tweeted about how, so it's really planted seeds, as you said, so many people have.
May I just ask, have you tweeted about your bike ride to here?
I have to say, I didn't cycle here, I got the train here, but I did cycle to the UK Stroke Forum up in Liverpool, so I can't take full credit for that, and I did tweet about that at the time.
Sorry.
No, so these are some of the main goals. I don't know if did I miss
There's also a whiteboard, so if someone wants to put input or share ideas, it can be done in the second floor. So
perfect.
Okay, well,
Fantastic. I think we are at the end of the session.
you are. Yeah. Well, thank you very much, and I wish you luck with your session this morning, and also with the tremendous endeavours that ESO is undertaking to try and push this all together.
Thank you very much.
Thank you.
Thank you.